All right. Well, thanks very much, Norm. A big welcome again to our 4 candidates for Hospital District 2 Commissioner, OMC, Tom Oblak, who's an incumbent, and his challenger, Jim Mcintire, and Heather Jeffers, and Karen Rogers. We're going to begin to do today's forum in 2 candidate 30-minute segments, beginning with Tom and Jim in the first segment, followed by Heather and Karen. And we'll begin with the candidates' opening statements and go to questions from our Nor'Wester Rotary membership. I'm sure we'll have a bunch more people added by then. All questions, of course, need to be addressed to both candidates. To ask a question, again, click on participants down at on your screen there, then go to raise hand, the raise hand button, and indicate it. And to keep things orderly, again, please keep yourself muted until you're recognized. With that, let's go to Tom Oblak and Jim Mcintire and ask each of these 2 candidates to tell us in a maximum of 3 minutes each who they are and why we and our friends should vote for you. And I'll hold up a note. I have a note here somewhere. Here we are. When you have 1 minute left. All right. Okay, guys. Let's see. We'll begin with Jim, and we go to Tom. Jim, 3 minutes.
Thank you, John. Good morning, Nor'Wester Rotary fellow Rotarians. Pleasure to be with you. I'm not yet fully caffeinated, so that'll change over time. But a little bit about me. I have served the country and the county for 46 years in total, as a Coast Guard officer for 28 years, and then as a senior federal civil servant, federal senior executive for another 6, rounding out my time in Washington, D.C. And Sherry and I moved out here in 2006. Little slice of paradise out here, lived north of Sequim, and found myself with nothing to do, and a friend of mine suggested I might think about running for office. So that was never part of any life plan or bucket list or anything like that. So sounded interesting. Ran for a seat on the Port Commission, won that election, served as a Port of Port Angeles commissioner representing Sequim for 4 years, ran for a seat on the county commission, and won that election and served a term as a county commissioner. I recognize a couple of names of folks who I worked with during those 4 years as a county commissioner. It's a pleasure to see you again. It's literally been years. Why am I running? What are the things that I want to, with my fellow commissioners, should I be honored and be elected? What do I hope to accomplish as a commissioner, 1 of 7? First thing is, of course, to keep the hospital district in public ownership. It's very important that decisions about our community's health care for the 2/3 of Clallam County's geography may be made here locally by local elected officials. Second, we need to take very great care and look down the road to see what kind of financial difficulties are coming. One difficulty that we know is that Medicare Part A, the piece that pays for inpatient treatment, is going to run out of its assets by 2026, perhaps sooner. And that will result in about a 9% cut in hospitalization payments unless Congress does something. Of course, the disaster preparedness is top of mind because we don't know when the big earthquake is coming, so we need to be ready. And last, we need to make sure that we think carefully about the capital facilities, the capital plant of the hospital. The buildings are getting old and maybe in some cases obsolete. So we need to think about what happens with healthcare over the next 20 years or so and plan accordingly. Thank you.
All right, Tom, over to you.
Good morning, everyone. My name is Tom Oblock, and I am the incumbent hospital commissioner from SQUIM. Over the course of my nearly 40-year healthcare career, I have had the opportunity to visit numerous hospitals, mostly in small and rural communities. Local hospitals are not only a provider of community healthcare, but also an important economic driver in their communities. These experiences have shaped my approach as a hospital board member. Olympic Medical Center's values align with my values: quality, safety, teamwork, compassion, respect, integrity, and stewardship. Stewardship is a critical board member role. Maintaining a strong budget not only equates to the breadth and continuity of quality hospital services, but also stable, well-paying jobs that contribute to the social economic health of our community. A hospital commissioner has to have financial acumen, committed to doing the right thing for patients and employees, and a knowledge of the complexities of healthcare payments, models, and regulations. My decades of healthcare experience, analytical skills, and passion for serving others demonstrates why I continue to run for hospital commissioner. 10 years hospital commissioner experience, membership on the Strategic Planning Committee, acting as chair of the Human Resources Committee, acting as chair of the Quality Management Committee, and I was also the board president in 2015. As a member of the Strategic Planning Committee, I have partnered with other board members, hospital leadership, and others to develop a roadmap for where we intend Olympic Medical Center to go and what it takes for us to get there. Healthcare today faces many challenges, and it requires working collaboratively with community members, patients, staff, physicians, and regulators. I have nearly 40 years of management experience in hospital operations for top 100 hospitals. As a former director of facilities engineering, I had the responsibility for the safety of all of our patients entering our property. Everything the patient touched was in my area of responsibility, from the patient's bed to their room to the medical equipment that they use. This responsibility underscored the intensive capital needs of healthcare organizations. I have managed multi-million-dollar budgets. As a corporate safety officer and a member of several quality review committees, I know the important aspects of what quality means. Community relations includes being a good neighbor, supporting health and wellness activities, and being a team player with community partners. I have actively participated in programs and promoted community health, including a community-wide effort to allow SQUIM Aquatic Recreation Center to continue its operation. In addition to being locally owned and operated, my other commitments are expanding primary care and improving access and reducing wait times in the emergency department. Thank you.
Right on time. Thanks very much, Tom. All right. Now, questions from the membership. Again, to ask a question, please go to participants and raise your hand. And for our first question, let me go to Laurel Black. Laurel?
Hello, thank you for both of you for A, for running, and B, for speaking to our Rotary. We're very glad to have you, and I think I speak for all of us in that we thank you for stepping up and running for office, which is never easy. So my question is, what are your takes on how OMC has responded to the COVID pandemic? Would you have done anything different? And if so, what?
Okay, Jim, could you go first with this one?
Sure.
Then,
Well, first thing I have to say is I think the hospital has done a magnificent job at infection control. I follow closely the daily reports that are in the newspaper about the progress of COVID in our community. I can't remember reading any one instance where a patient has come to the hospital or to a clinic, any physical facility of the hospital district without COVID and then left with COVID. Some of the staff have gotten COVID through family connections or community spread or something, but nobody has has contracted COVID when they didn't have it while they were at the hospital. So great job to the team and the staff at the hospital for infection control. What they've devised works. The other part of it is readiness for a surge of hospitalizations. Several weeks ago, there was as case rates rose in the county, there was a strain put on the hospital because of, I think the maximum number was something around 14 people that were hospitalized due to COVID. So they had the hospital staff did a great job at rearranging staff from clinics to acute care support for those patients. And that's just what hospitals do. Hospitals are always ready for some sort of a mass casualty event, and COVID has been sort of an elongated casualty event with occasional spikes. So I'm not sure that I would have, as a member of a governing board, insisted on some different approach, because what the approach has been seems to have worked just fine.
Okay, Tom?
Knowing what it takes to respond to an emergency event such as what we've experienced here in Port Angeles and the surrounding areas, I am so proud of what the OMC staff has done. Whether it be reassigning staff, creating negative air pressure rooms, vaccinating residents of our community, testing residents of our community, and the infection control practices that they have used are superior in their efforts. They are an outstanding staff. They deserve our praise and our attention. And I am very proud to once have been a member of that team and still a member as a board member. They do a terrific job.
Let me follow up on that just a little bit if I could. As of Monday's deadline, only 84% of OMC's employees were fully vaccinated. About 260 employees, about 16%, had sought and received exemptions. Let me ask Tom first, are you comfortable with that 84% vaccination rate at the hospital?
I'm disappointed with it. As you alluded to, some of them have received exemptions under the guidelines issued by the governor. I believe that there are 5 that have yet to either be vaccinated or request an exemption. And in following the governor's order, they have been taking off the work schedule. OMC has gone to great lengths to welcome these folks back if they choose to do so. We value our staff, we need our staff, and we want them back. So I hope these folks who haven't filed for an exemption or been vaccinated reconsider and join our team again.
Okay. Jim, again, are you comfortable with an 84% vaccination rate at the hospital?
I think the answer is it depends. You know, I encourage people, putting my public health hat on, I encourage people to become informed about the vaccines and to be vaccinated. I think that's the best way through this disease that we all know about. It depends part is what of those 84%, and that's a not inconsequential number, but it's not overwhelming. It depends on if those are back office positions or patient-facing positions, actual healthcare providers. I wouldn't be able to say that the hospital can accommodate that percentage of unvaccinated simply by moving them away from a patient-facing position, so that they would be working in a place and working somehow not to infect other people. I would like to see that number increase, of course. It makes sense for healthcare individuals to be vaccinated, I believe. But I do understand that there are some exceptions that can and should be made. If someone has religious convictions, or if their doctor or healthcare provider advises against getting the vaccine because of some other condition that they have. So Yes, bottom line is I would like to see that number shrink. I'd like to see the 84% go further down, but I lack information to know the real impact of that number on the ability of the hospital to function.
Okay. Jim Jones has a question. Jim?
I do, thank you. Moving forward, what do you see if you should be reelected or elected for the first time to this position as 1 in 7 board member? What do you see that you would like the hospital to be doing differently than what they have been doing the last several years, if anything?
Okay, Jim, let's have you go first on this one.
Well, the hospital is pretty successful, and if it ain't broke, don't fix it. You know, that's one of the many mottos that I have, Jim. And the thing that I think maybe needs some additional attention lies in the future of healthcare. You know, I discussed briefly the financial piece that's coming up. The hospital, I think, with the way I look at it, is a pretty efficient organization right now. It would be tough to accommodate a 10% cut, just round figures, and the most expensive things that the hospital does, you know, inpatient care, that kind of thing. So doing the work to become even more efficient, if that's possible, looking in all the corners and couch cushions for money that doesn't need to be spent, is a challenge for the future. That's continuous, but mostly I think we need to think about and try to imagine what healthcare looks like 25 years from now. What is the future of telemedicine and telemetry, with the big push, appropriately so, to extend broadband throughout the underserved or unserved areas of the county, of the hospital district? And how can we bring the doctor to the patient, or the patient to the physician, or ARNP or whomever, virtually, in ways that we have not seen over the last 100 years, let's say, and that we are getting a glimpse of today? What does that mean in terms of physical facilities? I talked about that. What kind of buildings do we need? Do we need 100-year buildings and then some buildings that are replaceable more cheaply? How do we distribute hospital facilities throughout the county so that we can be more ready for the big quake and the physical islands that we will all live on once the bridges are down in the bottom of the gullies and things like that? Those sorts of what do we need to think about today to get ready for the future aspects, I think, bear some attention.
Okay, Tom, what do you?
One thing that has been a constant throughout my almost 50-year career is that continuous quality improvement is something everybody strives for, whether it be working for the hospital or being a Seahawk player. If you listen to those folks, they say, my job is to come in here tomorrow, work harder, and become better. You can always do better, no matter how good you are. And that is always a quest of healthcare organizations. I firmly believe that. I've practiced that in my own life, and our community deserves nothing less than that.
Okay. Kathy Presley has a question. Kathy?
I would like to build off Jim's question. And could you please tell us what in your individual experience, or what aspect of your character, qualifies you and differentiates you from the other candidate in terms of addressing those single priority you just spoke to?
Okay, Tom, could you go first on this one and tell us again how you're different from Jim?
Well, you're gonna zero in on my closing statement, but I have worked in healthcare since 1971. I have worked on the East Coast to the West Coast. I know the cultures in the different areas. There are quite different dynamics. The majority of my career was spent in Florida, where it was a highly competitive market. Then I move out here, and healthcare is at a premium out here. The rural hospital districts that the state set up back in the 1940s is ingenious. There was a recognition from a physician in Forks that the only way that folks in these remote rural areas were going to receive health care was by setting up the public health districts. To him, we owe a great deal of thanks. If you notice, Forks is Hospital District 1, and that was to honor that physician and that legislator's legacy as for promoting public health on the North Olympic Peninsula.
Okay. Jim, how are you different? How are you
Well,
uniquely qualified for this job? Tell us.
well, the first thing is I don't wear neckties nearly as often as Tom does. I don't know if that's a distinguishing mark of my qualifications, but seriously, I've had many years of experience as an executive. I've led many high-level Washington, D.C. based staffs. I've been in positions where I have helped the senior leadership of whatever organization develop a strategy that goes out beyond 5 years and on out to 10 years. Once you get past 10 years, it's a little difficult to imagine the future, except in just more general terms. So I've had the experience of being an executive. I've had 8 years of local elected experience in governance. Those positions, those elected positions, are always about governing. How does the organization move forward operationally, and with the appropriate resources, with the appropriate plans, and with the appropriate strategy? That's the essentials of governance. So I'm very familiar with both the senior management of an organization, and the hospital is really a business. If a patient doesn't come to a clinic or to the hospital has no revenue. So it has to operate like a business. And so governance, therefore, is really key as far as the strategy of the organization, the annual work plan of the organization, and the budget, the resources that go with that, both in human beings and in financial resources for all the equipment that's necessary and so on. So I've had that kind of experience for about the last 18 years of my professional life, and I think that distinguished me. Last, and very quickly, I bring a fresh perspective. It's important for a governing board to have a variety of viewpoints, a variety of professional experiences and backgrounds, so you avoid the problem of groupthink. And so I am certainly not one for groupthink. So that's, I think, an important characteristic that I bring to the OMC governing board.
All righty. We're approaching our 30-minute cutoff, so let me go to closing statements. 2 minutes each, please. And Tom, let's start with you. 2 minutes.
I have been honored to serve as your hospital commissioner for the past 10 years. Stand ready and willing to serve you for another term. As all of you know, healthcare is a very complex issue. From the challenges of proper diagnosis and treatment to the complexities of health insurance payments. Add to that the mix of running a hospital 24 hours a day, 365 days a year, with services from emergency care to offering physical therapy for long-term healing. You have a gigantic challenge. I am proud of my term of office as an OMC commissioner. Our hospital has been ranked as one of the top 100 rural hospitals in the nation. Does that mean things work perfectly all the time? For me, a famous Vince Lombardi quote answers that question. Perfection is not attainable, but if we chase perfection, we catch excellence. As a hospital commissioner, I chase perfect in oversight of our local hospital. And the result has been the provision of excellent health care. Across the nation, rural health hospitals have been taken over by large for-profit corporations, and it has been a disaster for those local communities. In several cases, it has led to the closure of the hospital. I vow that on my watch as your hospital commissioner, I will not allow that to happen here. When we want our car repaired, a plumbing leak fixed, or surgery to fix a broken leg, we seek folks that have actual experience in their field. I know that to be a hospital commissioner, relevant experience is critical. My 40 years of healthcare, specifically hospital operations, is just that, relevant experience. My track record over the past 10 years shows that it has made a difference. So I conclude as I began. Thank you for entrusting me over the past 10 years for the responsibility of overseeing an irreplaceable local asset, the Olympic Medical Center. I humbly ask for your vote so I can continue to serve you as your hospital commissioner. Thank you for listening and caring.
Thank you, Tom. Jim?
Thank you again for the kind invitation to show up this morning at a very early hour and spend some time with you. I appreciate and value your questions. I always leave a candidate forum knowing more than when I came in the door, so to speak, virtually speaking. And so I don't run out of time and forget to ask for your vote. I do ask for your vote. I think I am very well qualified, as I've laid out before. No need to go over that ground again, to serve you as one of 7 officials on the governing body of the hospital. It's really important, vital, crucial for there to be a functioning, affordable, available, high-quality, patient-centered system of healthcare on the peninsula. We cannot, as a community or as an economy, survive or or much less thrive without that. So OMC and Forks community on the West End are vital foundation stones for the community. So therefore they demand the best in governance. I think I fit that bill. As I've said before, I bring a fresh set of eyes, fresh perspective, an awful lot of expertise in public budgeting and public strategies for public organizations. And I think I can be a very well-functioning member of this governing board. I do my homework. I ask all the tough and right questions to ask. And so therefore, I think I am worthy of your vote. I certainly, again, appreciate the time spent with you this morning and look forward to the next segment.
All right. Wow. Okay. Well, many thanks to both of our candidates, Jim Mcintire, Tom Oblak,
Thank you.
and for their time this morning. And thank you. Thank you. All right. We'll now go over to Heather Jeffers and Karen Rogers. And welcome again to Karen, Heather. And let's go to your 3-minute opening statements. And we'll start with Heather.
Hi, good morning. Thanks for having me here today. My name is Heather Jeffers and I'm running for hospital commissioner. A little bit about me, I live here in Sequim and I've been a member of this community for the last 18 years. My husband and I have been together for about 30 years. He's a graduate of Sequim High and our daughter Julia is turning 16 in 2 weeks and she attends Sequim High School and Peninsula College. We moved here from Seattle to take care of my husband's aging parents and have since taken care of grandparents and my parents, et cetera, many members of my family. I am the most qualified candidate because I have the academic, professional, and personal experience in healthcare, so I understand the complexities when making decisions. I'm a master's degree social worker, a certified geriatric mental health specialist, and a licensed nursing home administrator. I've worked over 20 years in healthcare, spending 10 years as a medical social worker and discharge planner in long-term care centers and hospitals such as Children's, UW Medical Center, and Swedish. I'm familiar with operations of a large healthcare organization, and I'm proficient in areas of strategic planning, budget forecasting, quality assurance, risk management, infection prevention, Medicare and Medicaid reimbursements, and human resources, just to name a few. I've successfully lobbied legislators on issues of reimbursement, resulting in passing legislation that increased Medicare and Medicaid reimbursements. I have received recognition in my company for my success in creating positive workplace culture, resulting in employee engagement and staff retention, and just recently was asked to give a training to other executive directors on this topic. I've also been recognized for my work in successfully turning facilities around. The issues most important to me are access to quality healthcare without having to leave the peninsula, keeping our hospital locally owned and operated, reducing ER wait times and improving patient flow, improving patient safety outcomes and patient experiences. I've spent my entire career helping patients gain access to healthcare while being a patient and family advocate. I want to serve as hospital commissioner because I want to continue pursuing my passion on a larger scale to reach more residents of our community that I've been a part of for the past 18 years. Thank you.
Okay. Wow. 2 minutes. Perfect. All right. You
I'm
have
a
1
fast
minute to
talker.
go. If you have anything else you would like to add. Okay.
I have a fast talker, sorry.
All right. Hey, Karen, over to you.
Good morning, Rotarians. Thank you again for dedicating your club time in the interest of all of our local offices. It's very important for our community. So again, I'm Karen Rogers and I'm running for OMC Hospital Commissioner, District 2 and the seat at large, which covers from Diamond Point to Joyce. It's the entire district. So here's why I'm uniquely qualified to be your OMC Commissioner. I have been a volunteer advocate for OMC for over 18 years. For healthcare programs, capital projects, funding, reimbursement, access to primary care, and veteran services. I've been a patient advocate and have served our community as a community advocate for many charities and also for economic development. And healthcare is part of that economic development. I bring in-depth knowledge to the board. I've attended all the board meetings all year long and prior years. I know and understand the budget in detail. I understand and participated in the strategic plan. I've read and understand several community assessment reports and have participated at the request of CEOs in many of the OMC community forums. OMC has many challenges and needs. OMC is limited on what it can and cannot provide. We need doctors and staff specializing in the chronic diseases affecting thousands in our hospital district. We need a financially stable hospital. OMC must stay focused on what it does best and expand in services that benefit the many and do it with manageable risk and financial accountability. So see, I'll represent you. I have no conflicts of interest. I have no business relationship with OMC, no family members working for OMC. And I bring experienced public governance to the table to work with my fellow commissioners. Advocacy and board relations, I did for 8 years on the Port Angeles City Council. And during the last couple of years, I was asked to actually think about running for the OMC Hospital Commissioner race. And I gave it great thought and I gave it great purpose. And I spent my time learning about it. So we need a variety of skill sets and community representation on this board. Every successful corporation or a nonprofit, any board always has a variety of skill sets to benefit the growth and accountability of the organization. Currently, 5 seats are held by healthcare professionals, and that is an asset. But I think it's very important as a community public hospital that we have a different set of eyes and ears also, and also a different voice for the community. And I bring that variety of business skill sets to the table. I'm passionate and I'm ready to serve you, and I respectfully ask for your vote today. Thank you.
Okay. Well, now questions from the membership again. And for the first one, let's go back to Laurel Black. Laurel?
Thank you both for being with us this morning. We really appreciate the effort it takes to run for office, as I said earlier. And here is my question. What is your take on how OMC has responded to the COVID pandemic? Would you have done anything different? If so, what?
Okay. Heather, could we go first with you on that?
Sure. I've been heavily involved with OMC with the managing the pandemic, and I think that they have done a wonderful job. I don't have any recommendations or anything that I'm aware of that I would do differently. Yeah, I don't have anything that I would do differently there.
Okay. Karen, anything
Yeah,
different?
Sure. I would like to first of all applaud the OMC leadership team for what they've accomplished during this. I think one of the things that was missing in some of this was a little bit more communication of the amazing work that they did also with the Jamestown Primary Care Clinic, North Olympic Healthcare, all the other clinics serving patients. You know, they would meet strategically and figure out what is it they could all bring to the table. And sometimes I think as we watch this unfortunate pandemic become so politicized that we lost some of the knowledge that I think could have been communicated a little better to maybe try and assure our community the benefits. And most importantly, I know it's always hard to pat yourselves on the back, but bravo to OMC and all the care providers who work so hard with public health behind the scenes, coming up with a strategy plan, how to share staff. And I know that because I was actually in the hospital taking person for their tests, and the person helping that day was from another healthcare organization. So there's some of the real successes that I wish we could get a little more out there so that the community had a greater appreciation for the amazing work that was done.
Okay, let me follow up again with the same question I asked the other two candidates. And go back to Karen for the first one. Again, are you comfortable with the 84% vaccination rate? Our health officer said she was extremely disappointed with that.
Yeah, this is a tough one. Yeah, this is a tough one because I know that the community looks to healthcare to be a leader, they're looking for them for that advice. But here's something I'd also like to point out. First of all, bravo on the PPE that was done. Because remember, the entire year before the vaccine was even available, everyone at OMC and their facilities and other facilities worked very hard to take care of patients. And they made sure that they were safe and there was no staff to patient transmission. And I think we need to acknowledge that. So now we go back to the whole politicization of this vaccine and of this virus. And here's what I've done, okay, to help with that. I've encouraged a person, you can't argue with a person about the benefit of the vaccine. And I asked them to go to their doctors, have a serious conversation with their doctors. So I know there are valid religious exemptions, and I know there are valid medical exemptions. There are some people with some types of diseases that cannot take the vaccine. They can't take any vaccine. So I'm gonna look to OMC. They've worked. We're not privy to that as the public. It's an employee relationship discussion, and I'm gonna make sure, and I'm gonna have confidence that they worked with all these employees to the benefit of doing the vaccine. And if they said no, there was the exemption process. They've obviously put them in positions where it's not in any way become any risk to a patient. I think we all can do a better job. It's just, this has been a very tough situation with how political and the out of control information there is in regards to the vaccine.
Okay, Heather, again, are you comfortable with an 84% vaccination rate at our hospital?
I think that what I would need to know, what I'm curious about with that is kind of what Jim touched on, is what percentage of direct care providers are vaccinated versus there's a lot of staff that have zero patient contact or that work in an office.
Okay,
So
just to inject on that, they will not give those numbers out.
Yeah, right. So with that being said, having, I have 150 staff. Since this mandate's come out, I've been responsible for making sure that all of my staff are vaccinated or have exemptions. I did not lose one staff member throughout this. I think that given the circumstances and everything that I know from having to talk one-on-one conversations with every single one of my staff members who was reluctant to get the vaccine, there's so many reasons that a lot of the public are not privy to, or don't, if you're not in the trenches doing the work, there's a lot of reasons why people are scared about the vaccine. So I'm sensitive to those. I think that number is good for where we're at. I think it will continue to improve. I think that the mandate came out very quickly and did not give employers much time to have those important conversations, address with the staff, address their concerns, their fears, and help sort out and mitigate all the misinformation that's out there. I am seeing those numbers continue to increase, and I think that OMC will continue to see that increase. I think that the mandate itself just came out with a deadline so quickly that that given that information, that's actually a pretty good number, given what I know from talking with everybody and all the concerns. You know, the hospital staff, one of their, or any healthcare provider staff, I should say, one of their concerns is, okay, they wear all their PPE, they're practicing all safety precautions. So they're protecting themselves that way. And so it's not a concern. You know, the general public might think, oh, an unvaccinated worker is a threat to the patient, when really the unvaccinated worker is the one more likely to get sick from the patient. And, you know, I just went through a 2-month COVID outbreak in my facility, which we recovered from, never spread it beyond 1 unit. And so I got to see firsthand what happens and how the staff, you know, which staff got infected, which didn't, which residents got infected, which didn't. So I have knowledge in that area, and it's been eye-opening and a different perspective. So given all that I know, I think that that's a pretty good number for where we're at right now, and it will continue to increase.
Okay, thank you, Heather. Norm Schaff's got a question. Norm.
Thanks, John. We've been talking through this forum a lot about what most of us as either residents or patients see, and that is, what is our direct interaction if we have to visit the hospital or one of the facilities for any given reason. But as commissioners, you're really involved more with high-level strategies and direction than daily operations. So I'd like, and both of the two in this current forum mentioned strategic planning as part of your area of interest and expertise. So I'd like to know what in the current strategic plan for the hospital district do you see that needs to be changed or given a greater emphasis or removed?
Okay, Heather, could you go first on this one?
Sure. I think that the biggest thing is focusing on the financial survival, given what's happening with Medicare reimbursements and also with how this pandemic has affected everything. So I think that moving forward, I mean, there's things that that has to be worked on with kind of accepting the new norm of the pandemic of COVID-19 being present. So I think that it is re-looking at where we can be financially and focusing on survival, the financial end of things.
Okay, Karen?
One of the things about the strategic plan is it does have measurable goals in it that are being tracked. And I think that's incredibly important. All of us in business, you know, you can create a strategic plan, but are you measuring it? Are you critiquing it? Are you holding your staff accountable to it? And this strategic plan has that. One of the things I'm very concerned about, and it's you're seeing a whole lifestyle change in our country in regards to what happened with the pandemic. And so, as we all know, there is a shortage of healthcare workers across the country. OMC has done a phenomenal job with recruitment and getting replacement doctors here, staff, nurses, et cetera. And as they reported at the board meeting Wednesday night, they have really targeted in. But we have some areas that concern me. And I think the strategic plan should also be accountable to specific areas of medical care and be accountable. And I'll give you an example. So for a hospital to have some financial gain, you want to make sure you know which services are profitable to a hospital. The top two remain orthopedics and cardiac care. Okay, those are typically the two you see in multiple hospitals as they expand services. You know, but right now we're going to lose half our cardiac care due to retirements and resignations. Okay. That's a huge impact for this peninsula if you look at our age demographic across the peninsula. Orthopedic care has been doing a very good job. It's very well respected, but there's still that comfort level, okay, of a person thinks they have to go to Swedish to get a knee replacement or get a hip replacement. There's a little uneasiness still. Do we really have that talent here? So I think it's incredibly important in the plan that they account to the community for the expertise that we have here so that we retain the patients. And I think that is critical to the plan, is retaining the patients, but also getting that staff that we really need.
Okay, we actually have another question. This one actually came to me in the old chat box here from Rebecca Miller. It says, Karen implied in her opening the conflict of interest. Talked about no conflict of interest, I think is what it said. Can she explain that? And also, Heather, is there any conflict of interest at your end, I guess? Karen?
Yeah, I think it's
Over to you.
it's very important when you're running for office. You know, I'm very familiar with the appearance of fairness doctrine and also the conflict of interest doctrine. Okay. And obviously I did my homework before I even considered filling out the paperwork to run for office, and made sure with the hospital they felt that there was no conflict of interest, which I don't. I don't have any business. I have no business relationship. I have no employees working there. I have no family members. There is no conflict of interest or appearance of fairness issue. Okay. And I made sure I cleared all that. Okay. You know, and I'll let Heather explain for herself. Her and I have a very different opinion of this. She does receive patients from the hospital. So there is a financial tie from her organization to the hospital. And I've seen this before with OMC and other conflicts of interest, and I have concerns about it. And it's as simple as that, but I have no conflict of interest.
Okay, Heather, I'm not to put you in a box on this, but just you could address it.
Yeah. I also did my homework and talked to, did the research, talked to many people that were in the right positions to answer, and determined that there was no conflict of interest before I made the decision to run. My business, it provides a service to patients once they leave the hospital. Patients have the right to choose what services they use once they discharge. Once they discharge from the hospital, they're no longer a patient. We do bill their insurance for their services. We receive no money from OMC. There is no contractual obligation with OMC. OMC is not the source of everything. We don't even accept all referrals that come from OMC. So our interest is not in conflict, but our interest is actually the same, which is quality care for all residents, and to have the safest discharge plans to prevent patients from ending up back in the ER after their discharge, prevent them from returning back to the hospital, which would have a detrimental effect to OMC. So the service that I provide is a service that is helpful to achieve OMC's goals towards their strategic plan. It is not in conflict at all. There are laws and regulations in place that prevent any kickback laws, that prevent any influence of decision-making. There's patient choice that is at primary. The primary goal of the discharge planners is to offer patient choice. They are required to equally provide information for all services to patients that they need when they leave the hospital. And to be honest, a discharge planner, they don't care who's on the board and what our business is. And, Heather is on the board. She's a board member. I'm going to refer this person to her facility. That's just ridiculous. That doesn't happen. And, OMC is a public hospital. So Karen had implied that in yesterday's KONP debate that I would have privy to information that would be privileged. I can't imagine what that would be, considering that OMC is a public hospital and everything is public anyhow. So there isn't, there's no conflict of interest. In fact, it's the same interest.
Okay. Jim Jones, do you want to ask your question of the second set of candidates?
Okay, as each of you would be elected to the first time for the board, moving forward, what do you see as personally as something that the hospital's been doing, if anything, that you would like to see changed or done differently?
Done differently. Okay, Heather, I'd like to have you first on this one.
Okay. I'm not, I don't have any agenda or any such. I think that the hospital does a phenomenal job. As Tom said, that there's always room for improvement, and continuous improvement is always a goal. One area that I see opportunities for improvement is in the emergency department. Given my long history and experience as a hospital discharge planner and a social worker, I see lots of opportunities for improvement of things that could be done with those patients that hold up hospital beds or are difficult to place. So that's an area that I see an opportunity for improvement.
Okay, Karen?
So the opportunity I see is telehealth. And I think any of you in the last 20 months with this pandemic, as if you had to consult with experts across in Seattle, I can tell you for a family member, we had numerous consultations with UW, got to see through telehealth, got to see the detailed MRI exam. The doctor visit was phenomenal. And I think that's a great opportunity for OMC to deploy, because as you now see, people didn't go to the doctors for over a year. And now all of a sudden they're all trying to get into their doctor appointments, or they become so ill they're ending up in the hospital because they did not maintain their health. So I think the opportunity of telehealth provides a new revenue stream, but most importantly, it's about the patient quality healthcare, and it's about keeping in touch with a patient. And if we ever have to go through this again, I think we need to take those lessons forward. But the future is telehealth. That's how you're going to be able to deliver additional quality centered care. And so I would love to see that happen.
Could I ask, Karen, is there telehealth now at OMC?
No.
Okay. Heather, over to you.
I already answered the question. Was there a different question?
Okay, I'm sorry. I just wanted to go back, see if you wanted to answer. Are you aware of any kind of telemedicine or anything specific on that?
Yeah, I know, because I've had family members. My mother actually was in the hospital for multiple TIAs, and she had telehealth visit with a neurologist. And so there are some, I think it definitely has opportunities for improvement, but there has been telehealth available.
Okay.
So can I respond to that?
Of course.
The telehealth is set up by a doctor here. And so if you're dealing with a specialist, that's when the telehealth comes into play, like what's happened with UW, Swedish, Virginia Mason, Cancer Center, then you have that ability to do that. But as far as calling up your primary care and being able to do a telehealth appointment, that's still not there yet.
Okay. Anything else, Heather, on that? Okay. Karen Presley asked, I thought, a very good question of the previous two candidates. So I wonder if you would want to repeat that to Karen and to Heather. Kathy?
Yes. In light of your responses as to a priority that you feel you could have an impact if you were elected to the board, how do you feel you are uniquely qualified to be a champion or a leader in bringing that forward?
Okay, that would go to Karen first.
Well, sure. I'll speak in regards to telemedicine. I came to this peninsula. I actually was transferred from a company here. And at that time, it took over 8 months to get an extra one telephone line. Okay. So from that day on, I was relentless and a champion of broadband. And I think, and I teamed with many people on this peninsula as we brought, fiber to this peninsula so that it can enable our community being remote to be able to be in the next century of communications. And so I bring a strong background of the advantage of technology and what that means, what you have to do, how you have to deploy it. Doesn't mean that's the solution to everything, but let's face it, infrastructure is critical to every organization and to every person on this peninsula. And so I understand the benefit, and sometimes infrastructure isn't such a sexy, fun topic, but I'll tell you, I've been a champion of infrastructure since I've been here on the peninsula.
Okay, Heather.
In addition to, like I've already spoken about with my experience in healthcare and understanding the operations end of things, I'd like to I think that what's unique about what I can bring to the table is I have that long-term care perspective with the demographics of our area and our patient needs between the mental health and the skilled nursing into things. I bring that perspective. I see what happens when patients leave the hospital. And it's important to see what happens when patients leave the hospital in order to really evaluate and look at what could have been done better, what services are lacking, how could we have prevented that rehospitalization or those multiple ER visits. So I think that my experience with the long-term care and my social work experience and my geriatric mental health experience, I have a different perspective than any other board member that currently has a healthcare background. So I feel like that's unique about me, in addition to just the general education and experience of my healthcare career.
Okay, well, thank you very much, Heather. We're approaching 8 a.m. And the sun is beginning to come up. Let's go to closing statements. 2 minutes each, please. And we began with Heather. Karen, we're going to start with you for your closing statement. 2 minutes, please.
Well, thank you again for your time today. Great questions, by the way. This has been a wonderful forum. So I'm prepared and I'm ready to serve you. And again, this is about you, the patient, you, the community member. This is not about me. It's not about me running for another office or for me to bolster my corporate resume. It's about bringing my skill set to you. And I think it's incredibly important that there's a different set of skill sets on this board so that we're looking at things from all angles, all viewpoints, but never losing the focus that this is about you, the patient. It's about your health care, and it's about the quality of your health care. Healthcare for all of us on this peninsula is paramount. It's paramount to our quality of life. And we have been through some pretty big health care storms in the past, and I'm ready to help chart your way through that. So again, thank you, and I hope that you'll consider voting for me.
Okay. Heather, 2 minutes, please.
Yeah, thank you so much for your time and invitation to speak here. I am just passionate about healthcare and about helping people. I do have a full-time job. So I'm not looking for anything else to do. I don't need anything else to do. So the fact that I'm wanting to jump in and help and participate speaks to that the level that I care, the passion that I have for helping improve this community's healthcare delivery system. As a social worker, I advocate for patients and their families. I help them navigate their way through our complex healthcare system. As a nursing home administrator, I spent the last 9 years running operations of a 90-bed, $20 million organization with a proven track record of success. I have turned 2 facilities from a 1-star Medicare rating to 4- and 5-star rating, reduced turnover significantly, exceeded budgeted financial goals every year, and greatly improved patient and staff satisfaction, all while relying solely on government payers with extremely thin margins. If I can accomplish all that, then I know I can make a positive impact on the OMC board while continuing to be the voice for all residents of our county. Our hospital cannot have successful outcomes on its own. It takes partnerships, collaborative efforts, support from businesses, and a systems approach to improve healthcare quality and safety. OMC administration is doing a phenomenal job, and I'm not here with any alternate agenda or intent to interfere with the path that they are headed. Having been in this community for 18 years, I have a lot of connections and existing relationships that can be helpful in those collaborative efforts. I want an opportunity to help OMC achieve their goals, and I feel I have knowledge and experience to contribute in a positive and unique way. Again, thank you so much for allowing me to speak today. I ask for your vote and give me the opportunity to serve as your hospital commissioner. Thank you.
All right. Well, that concludes our forum, and a big thanks to Heather and Karen, also to Tom and Jim. And thanks again. Thanks again.
Thank you.
All right.